I'm Alderman Will Burns, and welcome to Fourth Ward Headlines. Thanks for taking the time to join us today. With me today is Tom Dome, who is the Interim Chief Operating Officer at Provident Hospital. Thanks for coming in.
I appreciate the opportunity. Thank you.
Well, now, on the south side of Chicago, Provident Hospital has a long and storied history. You know, it was drilled into me at a pretty early age that Daniel Hell Williams completed the first open heart surgery there at the turn of the last century. Get us up to speed on what's happening at Provident now.
You are correct. Provident Hospital has historic roots on the south side of Chicago and very important to that particular community. And we're proud to be able to keep moving forward with that legacy and that relationship with the community. Provident Hospital is expanding from an outpatient basis, and that's really where healthcare is going these days as we continue to focus on prevention, on communication, on outreach, trying to reach patients before their illnesses become so acute that it's costly or dangerous for them. So the Cook County Health and Hospital System, as well as Provident, has made a commitment to provide those outpatient services at Provident Hospital. We still have an inpatient component. We have a 25-bed unit that provides inpatient med-surg level care. We have a full-fledged ED. Even though we don't have...
You want to...
Okay.
For those of us who aren't in the lingo.
Sure. We have a full-service emergency department or emergency room. And it's important to mention that because I think there's been a misunderstanding because most of the residents have learned that Providence no longer accepts ambulance runs.
Right.
But that doesn't change our mission or our services in that particular area.
So if your kid stubs their toe, or you think the kid might have a broken arm or a fever over a couple of days, and you want to take the kid to Provident Hospital, you can still drive over, come in, and you're fine.
Absolutely. We still have emergency trained physicians, a full complement of staff. In fact, our occupancy, or our, I should say, traffic through the emergency department has not really changed since the elimination of the ambulance runs. So the patients and our community still finds an opportunity to come to Provident for ED services. In addition to the ED and to the inpatient, we have both primary care and specialty care services as part of our Sangstedt Clinic. And the clinic is an outpatient-based clinic area, and we see thousands of patients a year in that particular area.
And really sort of matching people with a primary care physician is really critical in terms of avoiding chronic diseases like diabetes and heart disease and high blood pressure that lead to more costly diseases that have to be treated down the road.
Absolutely. Our intention and the hope is to create a medical home where a patient finds a primary care physician in our system, and we can provide the full array of services that they need, either in that primary care range, or if a specialist is necessary, we have that capability as well.
And I think it's important too to know that specialty care is available, obviously, on the south side of Chicago.
Sure.
So people, what kind of specialty care is available at the hospital?
Well, we have cardiology. We also have endocrinology, which would be for diabetes. We have a new chest clinic opening up. That actually is going to be on Monday the 16th. We have psychology. We also have urology and clinical neurosciences. So we have a full range of outpatient services.
And if I went to Provident Hospital and I didn't have health insurance, what happens?
You are treated with dignity and respect because you are our customer.
Wow.
Our mission at Provident and in the health system is to be the safety net facility for the entire county. And we take pride in providing excellent care for our patients regardless of their ability to pay. So it's not unusual, and our patients feel comfortable coming to our institution, recognizing that their particular pay status is not criteria to determine whether they're going to receive care or not.
So it's almost like you provide universal health care through emergency department services, and people need health care, they're not going to be turned away. Everyone has access to that sort of basic floor of health care service.
You're right. And we would prefer, however, that they not make access to our health system through the emergency department. And just as you mentioned, we would rather them call up and request an appointment with a primary care physician and be seen in that area instead of going through the process of going through the emergency department.
And you could still see a primary care physician without having health insurance?
That is correct.
Wow.
Yes.
Well, you know, we were talking a little bit before we started the taping about the importance of the Affordable Care Act, and I'm no expert on the Affordable Care Act, but my understanding is that there will be an expansion of the Medicaid population. The federal government's going to offer states a lot of money to provide additional coverage for Medicaid, and my understanding is that that will reduce the number of people who lack health insurance. Is that right?
That is correct, and in fact that would be of great benefit to the majority of the patients that we see. As we've kind of discussed, the majority of our patients are self-pay.
And that's an interesting euphemism, right?
It is, and that means they're responsible for paying for the services that they receive. Obviously that makes it very difficult on that particular patient population. So the Affordable Care Act, the idea is to expand coverage so that the vast majority of the patients that we see are covered under a federal program. One thing the health and hospital system is attempting to do in addition to the waiting for the Affordable Health Act is looking for a waiver called the 1115 waiver. And the intention is we're trying to capture and reach and discuss and talk and educate our patients right now about health insurance and the Affordable Health Care Act now, so they become a part of our system now, that they get a relationship with a primary care physician now, and we keep them in our system so as they need services throughout the full continuum of care. That's another health care term. Everything from primary care to specialty care to chronic disease or geriatric care to hospice or long-term care. That's the full continuum of care. Well, and it's the county's attempt or mission is to provide services for all those levels of care.
Well, it's really important too, because now that those folks will have health insurance, they become attractive to other hospital systems which have tended not to serve people who didn't have the ability to pay. Now that they have the ability to pay, other hospitals may say, hey, why don't you come over here and avail yourselves of our services in our hospital. And so the county, in an interesting way, where it didn't have a population that it had to compete for in the past, is now going to have to compete for this population that now has health insurance and is you know, which is a great thing. But the viability of the county system will depend on keeping these people coming back.
You're exactly right. And one of our initiatives moving forward is to continue to improve and enhance the patient experience, because we want our patients to choose to come to Provident, to choose to stay in the health system, when perhaps previously they don't have many choices. You're right, they'll have choices, so we're going to be competing, and we want to provide the patient with the best experience possible so that they choose to stay with our system.
Well, I noticed a few years ago, you know, when Michael Reese closed down, you know, there was a lot of concern. There were some articles about the lack of access to health care on the South Side. So obviously, Provident providing the services that it provides and the emergency room being open is really critical to sort of meeting that need in the community.
It absolutely is. And the location of Provident Hospital is so critical to that particular area. The patients that we see are so grateful for our location. Many times they will have to travel, maybe even to Stroger Hospital up north about 7 or 8 miles. And believe it or not, that distance is really quite difficult for many patients.
Well, especially if you're on public transportation, you don't have an automobile, you have to figure out how to do it. That could be a bit of a challenge. Well, I know one of the things that you're doing to help bring Provident to the community is to work with us on our health and housing fair. So, as you know, Tony Preckwinkle was the alderman of the 4th Ward for 19 years. I'm in at the beginning of my 2nd year of my first term as alderman, and we've really kept a number of the events and activities that the former alderman had. We kept those on the books, and so we're doing our annual health and housing fair August 18th at King High School, and Provident Hospital will be there.
Yes.
And can you talk a little bit about the services that you're providing
Sure.
at our health and housing fair?
We are very proud and happy to be participating once again, and Provident Hospital has provided services at the health fair for the last 18 years.
Wow.
And we're going to continue that tradition this year. There's two major components that we're going to provide. One is regards to physicals for school-age children.
So if you have a school-age child, you have to have a physical in order to enroll them in the Chicago Public Schools. You can get that done at the Health and Housing Fair.
You can get that done at the fair, and it's a full physical, so it meets all the requirements of Chicago Public Schools and provides, obviously, a nice service for the community. There's a system in place where immediately after the physical is complete, that the child is registered as having completed their physical. So there's a little high tech involved where there isn't a gap in time waiting for paperwork to get from one location to the next. So the physicals are a big component of the services that Provident will provide. And then secondly would be for seniors, senior health issues and screenings. Dee Clayton, who is our system director for community outreach, organizes this event and has even taken on a little bit more responsibility this year to try to continue to find vendors that can participate in this. So we have there's two areas. We're gonna serve pediatric needs and also needs of the seniors. So the seniors can come in and get blood pressure checks, checks for diabetes, those kinds of health screenings.
Well, last year I took the diabetes screening, and I kept telling them, I don't need to take this, I'm fine. And they were like, oh, come on, Alderman, take the test. So I took the test, and they told me, of course, I was fine. But if someone else really needs to know what's going on, they can get the screening. And that's one of the many services that we'll provide at the Health and Housing Fair. And again, for our viewers, that's August 18th at King High School, 45th and Drexel, from 10 a.m. to 2 p.m. And I can't say enough about how grateful I am for the work of Provident Hospital in terms of providing access to health care. And I think some people who don't have health insurance don't know that they can just come in and get the services they need, and hopefully signed up for Medicaid at the same time, because you can provide that service as well, if I'm not mistaken.
That's right.
So that you're in the system, you have a doctor, and so people should come to Provident. Is there a number they should call if they want more information?
They can call my office directly, probably be the easiest for any information about Provident Hospital, 312-579-1200.
All right, so why don't we say that one more time, and just so people can get it down if they're looking for a pen.
312-572-1200.
Okay, great. Thanks so much, Tom, for joining us today. And thank you for tuning in to Fourth Ward Headlines. I hope you'll join us at our Health and Housing Fair on August 18th at King High School, 45th and Drexel, 10 a.m. to 2 p.m. Be well. Thanks. Welcome back to Fourth Ward Headlines. I'm Alderman Will Burns. Joining me now is Chef Michael Digby. Chef, thanks for joining us today.
Thank you for having me.
All right, so I always like to ask our guests sort of where you come from and how you ended up in your chosen profession. And we were talking a little bit earlier, so why don't you share with our guests what you shared with me?
Well, I'm from Chicago, born and raised.
Okay.
And I'm a chef here in Chicago, in which I love cooking, everything about cooking, how it brings families and friends together, and how it just makes people happy. I got in this field because I was always in the kitchen with my mother, every day, cooking and